Hello, here's the One Team Working COVID-19 update for Friday the 6th of November. If you have any concerns or worries at all about COVID-19, please do give us a call on the absence line. We are here to support you. Number one on the absence line is for all absences, which are non or COVID related absences. And also number two on that line is the support and queries line. So please use it if you have any concerns at all. A reminder here for all staff to please carry your key worker letter and car sticker during your journeys to and from work. You might be stopped and asked to prove that you're a key worker, so these will help you do that. So if you don't have them, please get in touch with IMS immediately and they will get them sorted for you. We also suggest that you make sure you have the absence line number on you at all times in case you need to contact us urgently for various different reasons. You know, if you have any symptoms, you need to call us urgently, and also just to, you know, if someone is trying to prove that you are a key worker, we can do that over the phone as well. Weekly testing has proved its value at the Old Vicarage, identifying a small number of asymptomatic COVID-19 infections of individuals and staff, so please keep making yourself available for the testing. As disappointing as these first infections are, thankfully we are extremely well prepared, as since February our business continuity plan has been continually preparing and re-evaluating for what we had assumed was a certainty. The amazing staff teams at the Old Vicarage and Vicarage Lodge have been fantastic in putting themselves forward for standby shifts and picking up where they can, whilst always supporting each individual to the very highest standard. Please redouble your own infection control measures, ensure that you're using wizard water and PPE correctly, and that you are social distancing from colleagues unless it's absolutely unavoidable. Outside of work, please follow the lockdown rules. These are highlighted below. And you know, given the smallest chance this filthy virus will find its way in, and whilst we might not always stop it, we can minimise it. And as the current outbreak shows, we can reduce its impact on everyone. So thank you for everything you're doing. Remain vigilant for the safety of everyone, and never forget you're a social care hero. And wishing a very speedy recovery for those that are infected. And that's from Paul, Anne and Hugo. A reminder here about the COVID-19 symptoms. So if you display any of these main symptoms, you need to get a test as soon as possible. So a high temperature, whether you feel hot to the touch on your chest and back, a new continuous cough, which is coughing a lot for more than an hour or over 3 coughing episodes in 24 hours, or a loss or change to your sense of smell or taste. So if you notice that you can't smell or taste anything, or if things taste a bit different to normal. Most people with coronavirus have at least one of these symptoms. What to do if you do have symptoms? The first thing is to call the Home from Home Care absence line. That's the very first thing you need to do. You need to get a test to check if you have coronavirus. If you or anyone anyone you live with, you should stay at home until you get your test result. Only leave your home to have the test. You need to wait for the test result to come back before you can leave your home again. Anyone in your support bubble should also stay at home if you've been in close contact with them since your symptoms started or during the 48 hours before they started. Okay. And then here is the guidance around the national restrictions. There is more information on the government website, quite detailed information. So please do make sure you are completely aware of all the different restrictions that are in place. Our amazing One Team, thank you to all staff who are continuing to go above and beyond and covering those extra shifts for absent colleagues. This is fantastic and necessary in order to keep individuals safe and well supported. If you haven't done so already, you can join the standby residential shift rota for your home. This shows on the rota as a standby residential shift with the staff name showing outlined in pink here. To show they are a standby, which is the same as the sleeps. Whilst this is voluntary, once you're on the rota, you're committed to working the shift. Okay, so please bear that in mind. Another important point here is you must turn off Bluetooth on your personal phone as soon as you arrive for your shift and put on your PPE. This is all to do with the NHS Covid-19 Test and Trace app. When you arrive on shift and put your PPE on, you must turn the Bluetooth off on your personal phone. This will help prevent the Test and Trace app from making notifications which do not allow for you working in an environment where protocols are in place to ensure that medical grade PPE is worn at all times. Okay, as soon as you get set foot on location to a service, and have your full PPE on, that Test and Trace app is no longer required. Okay, so you need to turn your Bluetooth off. What's on in November? Please remember to film and photograph all activities and upload them to daily diaries as an SC activity pack. From this week, we've got Guy Fawkes and the Scarecrow competition, so please do get all of your entries into us. Send an email with the photos and videos, everything for the Scarecrows to the communications team, and we're looking forward to seeing everybody's. Next Saturday the 14th is the Diwali Tea Lights celebration, which is creating beautiful lights to celebrate the special festival. The 17th we've got cape making. We've got capes and kits to decorate them, and that's getting ready for the Superhero Mermaid and Unicorn Party on the 21st, which sounds fabulous. And it'll be catered, and it will feature some of the individuals' favourite characters. On the 23rd, we've got Christmas canvas bags, which is a chance to get festive and make personalised gift bags for loved ones. So that'll be a really lovely activity to get involved with on the 23rd. And then on the 28th, we've got puzzle making, which is another crafty challenge coming through. And then, of course, we've got HPHC Fresh. Next week, we'll be serving up ingredients and recipe cards for barbecue ribs with jacket potatoes and slaw on Monday. And then we've got tasty beef curry on the Thursday, which sounds great. Absence management. There is a change in the process. Due to ongoing developments within the organisation and to offer the best support to staff, we've updated our return to work process. The absence management policy has been amended to reflect these changes. Please ensure the related clickets is acknowledged for this. All staff will be receiving an updated absence card. The main changes within this process are as follows. An absent staff member must contact the absence line when they know their date of return to work so that the cover arrangements can be cancelled, and support can be provided to the absent staff member prior to their return if required. For an AM shift, you must call before 5 PM the day before. For a PM shift, you must call before 11 AM that day. Night staff must call before 5 PM that day as well. Please ensure you read the amended policy for the full update, and any queries, please speak to a member of the IMS team. On Care to Craft, this weekend we've got Remembrance Day, and on Care to Craft we've done a poppy making session with Georgia and Anne-Marie, learning how to make some beautiful remembrance poppies. Kits have also been sent out to you to the homes to be able to do this, so yeah, do tune in to Care to Watch and have a go at making some really great poppy decorations. And then here are some photos of what's been going on for some of the individuals this week. Lovely. Thanks everyone. Have a good weekend, and I'll see you next on Tuesday.